morning. Good morning. Today I'm going to speak about change in technology. I mean, change in technology when you are trying to move from manual system or paper-based system to electronic platform or to introduce technology in your workplace, especially in health information environment. That means you are trying to move to health informatics, because health informatics has to do with the application of computers to healthcare environment. And in this aspect, there's need for change management. Yes, change is necessary, change is inevitable, change is a must. In fact, there's nothing as constant as change, because change must creep into our lives, into our work environment, into our environment, into everything, because everything is under the power of change. But then, change in technology from paperless or manual platform, even though it's very, very important, it often comes with some problems or difficulties or backlash. This is because you've not prepared the change. That's the reason why change management is always necessary. Change process has three stages. Number one is unfreeze. Unfreeze, just like the ice block in your refrigerator, you need to unfreeze, the negative perceptions and negative mind feelings and ill feelings and misconceptions about the intended change, so that when the change comes, it will be welcome. And this has to do with changing the negative perception to a positive one, because change is always associated with job losses. If technology or computers are introduced, then you have to substitute it with the fact that it's not going to create a job loss, but rather it is going to improve efficiencies and effectiveness, and also improve the performance of the staff, not about job loss. Fear of losing position, you have to build confidence that it's not going to be so. Nobody is going to lose his position. Instead, probably, it's going to be a training opportunity for those that lack that technical expertise, because technical expertise is also one of the reasons why people don't like to change. Yes, technical expertise is one of the reasons people don't like change. So also lack of trust, also fear of losing position, fear of losing status, etc. So you all have to build confidence on that before you apply the change. That is unfreezing. Now we move to the next stage, which is change. That means you have to put the change, you have to introduce the technology to the health information environment or healthcare organization. Since we are talking about healthcare organization, when you put the change, you don't just leave the change after putting it. You then have to move to the next stage of rephrasing. That means you have to now consolidate the change which you put. It can be done through ensuring compliance to the new change. Make sure that people are rewarded for doing the right thing, and those that try to refuse compliance, you also be punished. Yes, you have to query, you have to ensure strict control, and you have to also motivate. And that is the process of change management. Unfreeze, change, and refreeze. And I've told you, change is inevitable, change is a must, because things are changing. Job procedures are changing. Even the generation we have now are digital generation. They are digital network. They are digital natives. They are network generation. So we must adapt change. Thank you very much.